Hi there. Hello, everyone. I'm Tonya Rivens. Thanks for watching Canceling COVID. It's a place for real talk and real solutions to stay safe in the middle of the COVID-19 pandemic. We're still in the pandemic, folks. And of course, we're grateful for our sponsors, Mecklenburg County Public Health. You can contact them for more information and to get all your COVID questions answered. mecnc.gov. That's mecnc.gov for additional information. Or you can call 980-314-9400. They are supporters of this program that we continue to bring you each and every Wednesday and Friday. So thanks for hopping on. Also, thank you to Groundwater Solutions, Dr. Tracia Black. She will be on in just a moment. It's really hot outside, so hopefully you're taking the proper precautions. But what we want to talk about first up is a breakthrough, the fight to cancel COVID. There is some good news right now. The Pfizer vaccine has full FDA approval for anyone 16 and up. So that's really great news because some people were a little bit hesitant. As of last week, 70 million adults in the US were unvaccinated, and many of them argued and said they would remain so until the vaccine received approval from the FDA. So guess what? The approval has been granted, folks. So that brings us to our question of the day. It returns. Yay. I see you guys hopping on. So hop in our chat and share your comments. The question of the day, will more people got vaccinated because of Pfizer's FDA approval? Again, it's been approved now. So that removes just one more barrier that people had or hesitancy when it came to getting the vaccine. So that's great news, especially for those that have been vaccinated. So it's official. The green light has been given. Jump in the chat and share your comments. Also, we have a very special guest today. We want to bring in Dr. David Jacobs. He works with Atrium Health and he works to help clear up a lot of the misconceptions about the COVID-19 vaccine. The goal is to help families make a decision based on facts, not fear. I was on the call with Dr. Jacobs and I really loved how I guess you would say his bedside manner of how he really showed empathy and passion in trying to get the accurate information out to everyone. So I'm very appreciative of that. Dr. Jacobs, thank you so much for taking the time to join us.
Thank you for having me. Glad to be here.
Absolutely. And thank you to Atrium Health for providing this opportunity. So let's start with the question of the day. Do you think that the FDA's approval of the Pfizer vaccine will motivate more people now to go ahead and get vaccinated?
I certainly hope so. You mentioned that it might have been a barrier for some people, or it might have been an excuse. I think we have to
Yeah.
be honest. Will people now try to find some other reason why they don't want to get vaccinated? But I read a couple of days ago that 30% of the people who've not gotten vaccinated, uh, the reason for that was because it was not FDA approved. So we ought to be seeing a big increase in the number of folks getting vaccinated now, if that was the reason.
Absolutely. And people have found plenty of reasons. Let me just interject. I know someone personally, three people that went and got vaccinated today because of the FDA approval. So I'm excited
Great.
about yeah. So hopefully it'll move the needle some. But you mentioned reasons why people come up with why they are not getting the vaccine. So Black Americans are three times as likely to be hospitalized and two times as likely to die from COVID, and the vaccination rates have traditionally they lag behind. And one argument is the vaccine hasn't been tested enough. So how do you respond to that, doctor?
Well, if you look at the three different vaccines that are available in this country, they have been tested in a very diverse group of folks. We, as African Americans, represent about 13% of the population. And certainly in the Pfizer and in the Moderna, at least 13% of the people who were in those trials were African American. And so we represent the same proportion in those trials that we represent in the general population. So hopefully folks will take a little bit of comfort in that fact.
And again, providing facts as people are allowing fear to kind of drive some of their decisions now. And the conversation that we had, I also love that you really emphasize acknowledging the hesitancy. So we can't ignore, it's justified, some hesitancy in the Black community. You know, the medical experiments on slaves, the Tuskegee experiment, as well as the testing of whole radiation. And the Henrietta lacks her stolen cells. There's a list of wrong that has been done, has been happened against African Americans in the name of science. Dr. Jacobs, how do you respond to that when people, provide that reason?
I think you have to respect them. You cannot look at history and say that African Americans have not been mistreated in the healthcare system. And uh, I would go on to say that there are ongoing episodes of mistreatment, but no one is going to look out after our health like we do. And so my response is find yourself a healthcare provider that you trust. If that's an African American, that's great. If that's not, and you still have that degree of trust, that's what you need to do. At the end of the day, this comes down to a one-on-one relationship with your healthcare provider. The best way we can help you is if you trust us. And so we're not asking you to walk in the door and just say, you're a doctor, you wear a white coat, I'll believe anything you say. It's a two-way street. So you have to ask questions. You have to question your physician when they tell you to, when they ask you to do something, so that there's a give and take. They understand where you're coming from. You understand where they're coming from. That's the best way of getting something out of the healthcare relationship, out of the healthcare system.
Dr. Jacobs of Atrium Health, and as I explained before, I love the fact that he takes the time to show empathy and explain to those that are in doubt or have questions. I think we need more of that, the one-on-one interaction. I've got a couple of viewers that have hopped on, and good afternoon, Erica Simonton Beatty, that have hopped on and decided to put comments in the chat. Travis Rivens commented on the question of the day. She says it's hard to say about the FDA approval because her mind has already been made up. And then Miss Dark and Lovely Macaulay says she's going to get whatever they say I need. And that's the spirit. You're talking about trusting the medical professionals and telling us and the scientists, this is what we need to do. And, my goodness, I know a lot of us are just kind of getting tired of this adjusted lifestyle. So, it'll take a little longer, obviously, but certainly we'll come through it. We just have to start making some sacrifices for what it's worth. Again, that question of the day: will more people get vaccinated because of Pfizer's FDA approval? Now, what about those that are talking about potential side effects, Dr. Jacobs, both long and short term? We constantly get questions from people who say, they're worried that if they get vaccinated, for example, it may have an impact on fertility.
Yeah, we can deal with that question pretty quickly. There have been issues, concerns raised on both sides, men and women, about how the vaccine might affect their fertility. There is no data to suggest that the vaccine will interfere with female fertility, male fertility, pregnancy, breastfeeding, on and on and on. We have to get hold of this virus. And let me just make a little side comment here. One of the excuses that we sometimes hear is, "I'm young, I'm healthy. If I get it, I'll be fine." But I think we have to have a larger view. We have to have a world view. We have to have a community view at the very least. And even if you don't get sick, you can pass that virus on. If we as a country, if we as a community had all gotten vaccinated as soon as we had the opportunity to do that, we wouldn't be dealing with this Delta virus. The virus would have been killed. But the longer that virus is around, the smarter it gets. It's going to evolve. Delta will not be the last variant that we're concerned about unless we squash it right now. So if you're not concerned about your own health, which I encourage you to be concerned about the health of the folks that you're coming in contact with. Be concerned about the folks in your community, in your country. And we need to be concerned about the folks over in India and Africa and everywhere else who haven't gotten vaccinated, because as long as that virus can circulate in any population, all of us will continue to have to deal with this virus.
I thank you for sharing that. And I often say, and I've said it before, of course, in scripture, love thy neighbor as you love yourself. And so many of us have gotten away from that. If you're not going to do it for yourself, do it for the others. So thank you for uplifting that as well. People around you, your neighbor, especially your family members, I think it's what you've got to really think about. Now, there is also concern about what's in the vaccine itself, the ingredients. What is it made up of? What is your response to that?
Well, it's made up of things that you're not going to believe me, but it's made up of things that can hurt you. So some of the viruses are made up. They take parts of dead virus and they make a vaccine that your body will respond to. I have heard claims that there's GPS particles in there so they
Yeah.
can track your whereabouts. There's all kind of things that are out there on the internet, and some of these are very, very professionally produced. You can, it's very easy to believe what you're seeing. Again, that's where having a trusted medical provider comes into play. You can believe what you hear on the internet, and you all know how easy it is to manufacture things and put things up on the internet, and how quickly those things can spiral out of control or go. I don't want to use the term "go viral" because we're talking about a viral illness here, but we recognize how quickly those things can sort of spiral out of control. So, um, but as far as the vaccine is concerned, you have to dilute it in something in order to give you the injection. And so all it is regular sort of salt water that this is dissolved in the minimal amount of salt water that it takes in order to put it into your arm. No GPS devices, no tracking devices, nothing that is certainly intended to hurt you, and no way that you can actually get the virus infection from the vaccine. That's another myth that's out there.
Yeah, that's a popular one. They're actually giving you the virus when they're giving you the vaccine. I've seen that.
Correct.
Now here's a question that I didn't put before you in advance, and if you're not familiar with it, that's okay. But we're seeing a lot about Israel and how they had been heavily vaccinated, but yet their numbers are starting to increase. That's another one that's on the internet. Are you familiar with what's happening there? Or are comfortable commenting on that at all?
Well, I think this is the same kind of situation. Keep in mind that you can talk about how many Israelis have been vaccinated, but you will also recall that they did not share their vaccine with their neighbors, and
Right.
so again, it just reinforces the point that I made earlier that if we don't squash this in the entire community, as long as there's a segment in the community that doesn't have access to the vaccine, hasn't taken the vaccine, that virus is going to remain in the community and then potentially reinfect those that have been vaccinated. And when that virus comes back, it's going to be that much stronger and that much more resistant to the original vaccine that was given, which is why you're hearing all these discussions now about new vaccines or third booster doses, those kind of things. And so I can't dictate Israeli policy, but we do know that the Palestinians were not afforded the same degree of access to the vaccine that the Israelis were. So this may be a policy that they may wish they had approached in a different way. I seem to have. Can you all still hear me? Hello?
All right, there we go.
Good.
Yeah, great.
Whew.
Technology there for a second. So, but I've got an amazing producer that knows how to pull it together. And of course, I heard your last statement, and that just speaks to again about loving our neighbor as you love yourself, going beyond the borders, guys. This is a global situation, and we can't just sit in our silos and address just the people around us. So, I thank you for uplifting that as well. I've got one more question, and I know your time is valuable, so thank you again. But part of the outreach you do is the Atrium Health Vaccine Ambassador Program, and I've joined that program as well because what I've been doing since January is exactly along those lines. So, can you speak about that just a little bit?
Yeah, the Vaccine Ambassador Program is, I think, recognition of the fact that we have issues with trust in the healthcare system, and that maybe a face that might be a little bit more familiar might be a better messenger for some of the messages that we're trying to get out. We're not trying to sell anyone anything, but we recognize that there's mistrust, and so I'm happy to play my part. If folks look at me and say, he wouldn't try to sell me a bill of goods. He's going to really do what's in my best interest, and we can get some folks to roll up their sleeves as a result of that. Then I'm very, very happy to do that. So um, uh, we recognize that we have to work twice as hard because of what's going on in the past, and that's really what the foundation of the Vaccine Ambassador Program is, to really get the message out to people from people who hopefully will have some credibility in the community.
Well, thank you so much, Dr. David Jacobs, Atrium Health, joining us. And you can see community benefit at atriumhealth.org. Anyone interested in becoming a community vaccine ambassador, I'm sure they're more than happy to speak with you. And what I really like about it is we get updates weekly on facts so that we can go ahead and deal with all the fear and the misinformation that's out there. Any closing thoughts, Doctor, as I let you go on with your day?
No. As I've said, we are happy to answer any questions, but everybody, I think, has a role to play here. If you've been vaccinated, then you're going to be a trusted face in your community, and you can speak to the fact that you may have had some side effects. They may have been minor, but don't wait for us to do all the work. We cannot do all the work by ourselves, and you all are just as much trusted ambassadors as I am. If I haven't convinced you that you need to get vaccinated, then we're just going to keep on trying, keep on plugging. But if you have been vaccinated, please, please, please consider the role that you can play in your community in terms of getting more folks to roll up their sleeves.
Absolutely. Great stuff. Again, Dr. Jacobs, I am honored and just grateful that you took the time out of your day to join us. And thank you for all that you and Atrium Health are doing to educate others in the community as we continue to deal with this pandemic. So thank you so much, sir, and enjoy the rest of your day.
Thank you. Bye bye now.
Absolutely. A great conversation, and you got it. Those are facts, folks, from an expert that is just having a great conversation. You know, someone is like a family member, making you aware and answering your questions and offering to answer even more. So I don't get it. If you want to make an informed decision, we got the resources out there, and they are trying, doing whatever they can to help you, especially get past of all these myths. Of course, now Mecklenburg County has also launched information website, teenvaxfacts.com, TEENVAX facts.com, which is also great for providing information. We're appreciative of that. We're now going to bring in our regular as we talk about a recent Kaiser Family Foundation survey. It found that 1/3 of unvaccinated people in this country would be more inclined to get vaccinated again if the vaccine had full approval. So now it has it. Let's bring in Dr. Tracia Black from Groundwater Solutions, also a sponsor of the show. And let's talk about this survey. And hey, Dr. Black, first of all,
Hi
thank you.
there.
Hey, well, the approval is here. And
Yes.
Kaiser Family Foundation is saying 1/3 of those unvaccinated said they're going to get it. So, you know, what are your thoughts? Our question of the day is around that. You think they're getting ready to roll up their sleeves and go get it?
I think a lot of people are going to go ahead and move forward with the vaccination. And then I think there's a portion of the population that we're using that as kind of their standing ground of why they're not going to get it. And I've seen those folks kind of shift to now there's another reason why
Yeah.
they are potentially not going to get the vaccine. But I think the FDA approval will bring us closer to where we need to be as a community.
Oh, good stuff. I see Tonya Harden has hopped on. She shared she's an ambassador. She said glad to see me and Dr. Jacobs. I wish I had noticed that while he was on. I had switched over,
Mhm.
but thank you, Tonya. She said she's going to keep talking to people, and I appreciate that oh so much. That's what we've got to do is keep providing information and facts. So now you're in Raleigh today, and you're working on a new collaboration to cover the state of North Carolina with more community health workers. Tell us a little bit about what you're doing.
Okay, so I'm in Raleigh. I'm in the office of Southeastern Healthcare of North Carolina, and we will be working with them to cover about 25% of the state with community health workers. Community health workers is a initiative that was launched in 2020 with the oncoming of the pandemic. The goal is to have folks who live in the community, who have their finger on the pulse of the needs of the community, who know how to not navigate systems and resources in the community, who will connect members to things that they need, whether it's housing, food, resources, COVID vaccines and testing. The goal absolutely is COVID protection. That's what brings the funds to be available. But our purpose is to address all of those social determinants of health, including access to COVID vaccine safety strategies.
So what it sounds like to me is creating some mini emergency resource centers where everyone's
Exactly.
pooling these resources, and I can just show up and say, look, I need help with this. I need help with that. And I love that because that's what it takes. And to that point, I'm not going off on a tangent, but I found out over the weekend that there's money out there, and we've been hearing about it, this digital divide. And if you're on fixed income, it's like $50 off a month, especially for our elders. And the money's there, but who knows about
They
it?
don't know about it, so they're not asking for it, they're not requesting it, and they're not accessing it. And then you end up with this pot of money that just sits unused, right?
Yeah,
So if you think of community health worker as being the media
yeah.
for public health, the media for public resources, so that we are going into neighborhoods. You don't have to come to us. We will come to you with what it is that you need. We will come with you with the information and the announcements so that these resources don't just sit there.
I really, really love that. And for those of you on, please share the word. All of the wireless companies have this money and they have access to grant you, if you're qualified, $50 off. So please share. Now you have to go on and fill out some information, but like my mom, I had to go on and fill out so to show that she, is on fixed income and then apply. And then they are obligated as long as we're in this pandemic. $50 off your bill is a nice little chunk of change. So please, please. Tanya says, is it available in Charlotte? Yes, it's available everywhere.
It's available nationwide.
Yes, it is
Okay.
available nationwide. It's a pot of money. And shout out to Cricket Wireless for bringing it to my attention. It's part of that emergency broadband benefit where the wireless companies have been granted this money. And I know that Cricket and AT&T are doing it right off your cell phone. I was told that Verizon does it off your data, but you have to apply. You have to not apply, but fill out the paperwork. And it's $50 if you are qualified. And there are a lot of people that are qualified right now. We're in these red zones. They've got Social Security, fixed income. All of that's there. So Darcel Lamar just asked the question, which vaccine is more effective with less side effects, especially for ones with underlying illnesses? Darcel, I really wish we had that question when Dr. Jacobs was on, because that would have been one that he is more than qualified to speak on. And then Tanya saying she wasn't talking about the Verizon and network stuff. She's talking about what you're working on, Dr. Black. So the program that you guys are working on, it's in the initial stages, but you're planning right now to be statewide, correct?
Right. Well, this program is statewide. There are 8 organizations or 8 collaborative groups that are all over the state. So there are community health worker programs in every county. In Charlotte, Mecklenburg County, the organization that provides community health workers is called KEPRO, KEPRO. I don't have their number on me, but if you look them up, you will be able to connect
Dr.
with
Black,
them.
we had them on. We've got the
Okay.
information. I don't know if our producer is able to pull it up, but I had KeyPro, their card, and then they provided someone from, I think, Symmetry Behavioral or something. They all work together.
So each of the community health programs usually have a collaboration of 3 to 5 organizations that work together in that region. And so that KeyPro is the lead for Mecklenburg. Our counties start around Guilford County and go all the way north till, I'll have to show you a map, but I want to say Halifax County, maybe somewhere in there.
Okay, good stuff. And back to KeyPro, we'll post it on our site. And to that point again, we're back, and I'm not bashing anybody, but I'm just being honest. They need to do more marketing. I met them out at a facility handing out cards, and I said, people don't know about this. They offer rental assistance. Also, if you need food, whatever you need. I said, but you guys have got to get the word out. You've got to get the word out to people. It looks like Tanya has posted a number, 704-859-4059. Thank you so much, Ms. Hardy. 704-859-4059. So
So,
Dr.
Tonya,
Black.
I would say to you that that is the problem with a lot of the organizations that come in to do community health work.
Mhm.
And we've been talking to the state of North Carolina about this a long time, is you have these organizations that are grassroots, that are on the ground, that are who the people call, but they don't get funding to launch larger covered services. And then they give money to some organizations who kind of sit with the money, but don't ever reach the community. So we've got to find a way to bridge that gap so that the folks who the community trusts are the ones with the resources to be able to deliver the services and supports that they need.
Absolutely. And that means, again, we need those that are watching to share and to spread this information, because we need to turn the heat up on our lawmakers and people that are handing out this money so that hey, we're not getting it. This program here is grassroots. What you do is grassroots. We're not getting that, but we
Mhm.
are reaching the people
We're
and
reaching
we're
the
getting
people.
information
Mhm.
out. So Tanya says she's looking at a flyer that was given to her on Saturday at a vaccine clinic that
Mhm.
she held, and that's where I met KeyPro as well. They were over at StarMed, but
Mhm.
everyone's not going to StarMed, and that's where they were handing out cards. Had them on here and gave them an opportunity, even reached out to them and say, hey, let's do some more. So again, I'm not throwing them under the bus, but I'm just giving you the facts that, and they're not the only ones either getting the
Well,
information.
I think that speaks to it. So I heard on the news that StarMed had to shut down yesterday because their lines were so long and the heat was so intense that for the safety of their workers, they shut down. But then you have other testing venues like our laboratories or other sister laboratories that we know, that we sit there with our staffs having really handful of work to do. But
Yeah,
it's kind of, you have certain places where the public is driven to go to those entities. And, I think Star Mount is very quality, but there are also other services that people
right.
can be, directed to as well.
Yeah, kind of spread it out. This is a serious issue in the entire community, so it shouldn't
Right.
be targeted towards certain locations. Everyone should be involved. Now, our time is starting to run out. I wanted to ask you one more question. The new numbers show people vaccinated for COVID-19. They have also contacted the virus in North Carolina, and nearly 1/5 of the cases, I know they're calling those breakthrough cases, I believe is the right term. That was in the first half of August. People were already fully vaccinated. Now, what do you say to people who use that information as an excuse not to get vaccinated?
Well, I just tell everybody that COVID-19 is very serious. It's dangerous. And you have to do, again, you have to do something to protect yourself. And the
Right.
vaccine is the simplest way to provide protection for you and your family. But we also know that just because you're vaccinated doesn't mean that you cannot contract COVID. We get vaccinated so that we can ideally potentially live through COVID, that we will
Right.
have less life-threatening circumstances from infection. But stay safe regardless of your status. Do something to improve your health. I keep preaching that. No matter your status, vaccinated or not vaccinated, get healthy. It's time for us to stop making excuses about our diet, making excuses about our choices to do things like expose ourselves to parties and things without masks. Just keep being safe and do something to ensure your safety. And the vaccine is one of those ways to do that.
These underlying health conditions, folks, we have
Mhm.
got to pay
We've got to
attention.
address it.
Yeah.
We've talked about it for years and years, and we say, well, we're predisposed for diabetes or we're predisposed for hypertension. Well, guess what? They don't exist to the extent they do here in America, like in places like Africa. So that means that we, as brown and black people, are not predisposed to those conditions. It's how
Yeah.
we live.
And Tanya added one more thing, which was that her play daughter was in a wedding last Saturday, unvaccinated, got COVID, and gave it to her 4-month granddaughter, which is what we keep talking about. She also pointed out Atrium, their vaccine clinic on Saturday. Most people are going to StarMed because they've got the gift cards, and I think they're up to $100 now. And that's to the point again. Why is it just certain locations giving out these gift cards? I mean, come on, people, it's right here before our eyes. But that's where we, as a community, we've got to demand better. We've got to speak up. And I believe that's the thing about it. We have got to speak up and share this information. So, Dr. Black, as we wrap things up, anything you would like to share with you guys? I know you're in Raleigh, but anything
Mhm.
happening and out today?
Well, I have a couple of things I want to share. One is for us to take COVID-19 seriously. I am seeing individuals of all ages that are becoming very, very sick, who are ending up hospitalized. And it's sad. I have a 35-year-old former employee who's hospitalized now, has a 14-year-old son, and she's had all kind of organ failures and other really serious consequences of COVID-19. So, it was time for us to wake up and just let's get serious, let's get safe, let's get healthy. The other thing I want to say is that as far as our collaboration with community health workers, we are looking for employees. If you are wanting to work, we start at $20 an hour for community health workers because we want you to have a living wage that you and your family can be comfortable with. We are hoping for partnerships with churches. We are hoping for partnerships with grassroots organizations. So if you want to be tested, vaccinated, you want us to come out, you want to partner with us for community health work, please call us at 704-596-0505. Thank you so much.
You, and that's even more great information. So again, an opportunity for employment and at $20. So this is really, really good stuff. And everybody's working really hard trying to recruit employees an opportunity to really earn some money and build a career. So thank you so much for sharing that. We'll put up Groundwater Solutions information as well as the phone number again. Dr. Black, I appreciate you. Thank you for the support of canceling COVID. Again, Groundwater Solutions, reach out, groundwater-solutions.org, 704-596-0505. And keep us up to date. Of course, we'll talk again next week about this group that you're working with of community health workers. Thank you so much.
Thank you. Bye-bye.
Safe travels. Hey, guys, it's the first day of school for Charlotte-Mecklenburg and many of the local districts. I am praying so hard. I told someone that yesterday that all of this will be successful, that our kids are wearing their mask and they will do the part of being physically distanced as well as just personal hygiene. Any questions or concerns about COVID-19 and the safety protocol in your children's schools? We'd love to hear from you. Reach out to me, Tonya Rivens at AOL.com. Again, that's Tonya, like Miss Harden, Tonya Rivens at AOL.com. I would love to hear your concerns because school is back in session, folks. So keep that in mind. And for those of you with teenagers, I mentioned this earlier, the North Carolina Department of Health and Human Services, they just launched a new website. It's teenvaxfacts.com, TEENVAX facts.com. It's a great place for your teens to learn about COVID-19. And remember, children as young as 12 can now get the vaccine. So the Pfizer vaccine, that is. So keep that in mind. We're getting ready to hop off, folks. So I appreciate you joining us each and every week. We're back here on Friday. Do me a favor. Please share this conversation so that more people can find out. We've got real talk addressing the pandemic. We try to find real solutions so that we can work together to cancel COVID. As always, life's challenges make you better, not bitter. I'm Tonya Rivens. Thank you all so much. Again, it's Team Vax, V-A-X, facts.com, teamvaxfacts.com. Have a great day, everyone. It's hot outside. Stay cool, but most importantly, stay safe as we continue to work on getting through this pandemic. Thank you to Mecklenburg County Public Health, mecnc.gov, and thank you to Groundwater Solutions. Thank you, Atrium Health, for Dr. Jacobs as well. A great conversation with great information. Bye, everyone.